Hey there, welcome back in. It is 9:47. Well, Alabama has one of the highest rates of cervical cancer deaths in the country. Health experts, though, say several factors can bring those numbers down. Dr. Clayton from the Princeton Baptist Medical Center is here today to talk about this. Good morning.
Good morning.
It's good to see you.
Thank you.
So why is that the case for Alabama?
Why is our cervical cancer rate so high in death? I really think the biggest reason is that people aren't being screened enough. And in addition to that, we find that people just aren't getting the follow-up that they need. So they have the screening, but they don't come in for the follow-up testing.
And so what we know about cervical cancer is different than ovarian cancer, because there's a way to find out if you have cervical cancer. So talk about that for a moment.
Yeah, so the biggest way that you find out is that you come in for your routine pap smears. Based on your age, we decide whether or not you have them every 3 years, every 5 years. But the biggest thing is that we need to see you, because most women are asymptomatic. Like you said, they don't have any symptoms at all.
Right. So what happens when you are diagnosed with cervical cancer? What's the treatment? What first happens?
So first, if you have that abnormal pap smear, we do a procedure called a colposcopy. So it's a microscope that we use in addition to some medications to look for those abnormal cells. And then we take some biopsies. And from those biopsies, we're able to decide if you have cervical cancer. So once we've made that diagnosis, then we need to do an exam, like when you're asleep, so we can feel a little bit better, do some radiology studies, and then decide on your treatment plan. So if we catch it early, for some people, that could just mean a hysterectomy, or a hysterectomy with some additional biopsies, what we call a radical hysterectomy. And then some people who have more advanced cancer, they require chemotherapy or radiation treatments.
So it's like other cancers caught early. Your chances of survival obviously are a lot higher.
Absolutely.
And so I think when people, like when we were talking about that before we even came to you, everybody was going, why is that? Why are the numbers higher in Alabama? And they were wondering, can diet or anything, a lifestyle, have anything to do with it? But it doesn't?
Not necessarily. I think when we look at risk factors, we look at smoking, multiple sexual partners, having other chronic diseases like HIV also put you at risk. The biggest thing that we could do for our younger people is to make sure they're getting their HPV vaccine.
And we've just started talking about that in recent years. Explain for folks who don't know what that is.
So HPV is the most common reason why women develop cervical cancer. So a long time ago, we only did the pap smear. And most people think when they have their pap smear that we're just doing, I guess, looking at the cervical cells. But what we now know is, since HPV is the most common reason why people have abnormal pap smears, your pap smear is the cervical cancer screening, the cells, but it's also a HPV test. So if your HPV test is negative, your risk for developing cervical cancer or precancerous cells of the cervix are low. So the benefit of your HPV vaccine is to prevent even those abnormal cells
from it being able to ever develop.
Absolutely.
All right, well, just a little awareness today, because it is Cervical Cancer Awareness Month.
Yes.
And if you haven't had your checkup, it's a good time to make that appointment.
Absolutely.
Okay, Dr. Clayton, thank you.
Thank you.